Welcome to Review Central. This is Midwifery Reviewer number 4, featuring questions on primary health care. Please note that this reviewer is specifically prepared for the Midwifery Licensure Examination given by the Professional Regulation Commission of the Philippines. The questions on primary health care are specifically focused on the healthcare situations, issues, programs, policies, laws, and interventions in the Philippines, and may not be applicable to other territories. There are 10 questions featured on this reviewer. All questions are modeled on actual questions that appeared on previous midwifery licensure exams. Shall we begin? Question number 1. Goals of community development include: A. Encourage cooperative work of local leaders and outside experts. B. Enhance development of self-determination and efforts in local communities. C. Promote the improvement of the basic livelihood. D. All of these. The correct answer is D. All of the given answer choices are goals of community development. Question number 2. Which of the following is not a function of the rural health midwife? A. Refers cases needing further diagnostic and more skilled care. B. Serves as the clinician of the unit. C. Works with primary health nurse in planning and evaluating health services at the barrio level. D. Guides volunteers or clerks assigned to the clinic. The correct answer is B. Serving as the clinician of the unit is not a function of the rural health midwife. The professional functions of rural Filipino midwives revolve around 5 themes. These are: 1. Antenatal and postnatal care. 2. Basic emergency obstetrical and newborn care. 3. Health education and counseling. 4. Treating common children and adult infections, and 5. Health promotion. Referring cases needing further diagnostic and more skilled care, working with primary health nurse in planning and evaluating health services at the barrio level, and guiding volunteers or clerks assigned to the clinic all fall squarely under themes 3, 4, and 5. Serving as the clinician of the unit, however, does not fall under any of the themes mentioned above. Typically, a physician exclusively holds the function of a clinician in the Philippine rural health system. Question number 3. The frontline health worker in the community is the: A. Nurse. B. Physician. C. Midwife. D. Sanitary inspector. The correct answer is C. Midwife. Rural health midwives are considered as the frontline health workers in the rural areas, and have progressed to become multitask personnel in the delivery of healthcare services, amidst migration of other healthcare professionals. It is in recognition of this, that the DOH created the Rural Health Midwife Placement Program, or RHMPP, to address the inequitable distribution of midwives, and equip them for facility-based basic emergency obstetric and newborn care practice. Question number 4. The legal basis of primary health care is embodied in: A. LOI number 949. B. Republic Act number 6675. C. Republic Act number 9502. D. Republic Act number 7883. The correct answer is A. Letter of Instructions number 949. LOI number 949 was issued in 1979, by then President Ferdinand E. Marcos, instructing the Minister of Health and all official and personnel of the Ministry of Health, to design, develop, and implement programs which will focus on health development at the community level, particularly in rural areas. On the other hand, Republic Act number 9502 is an act providing for cheaper and quality medicines. Republic Act number 6675, also known as the Generics Act of 1988, is an act to promote, require, and ensure the production of an adequate supply, distribution, and use and acceptance of drugs and medicines identified by their generic names. Republic Act No. 7883 is an act granting benefits and incentives to accredit barangay health workers. Question number 5. What does RHMPP stand for? A. Regional Health Midwife Placement Program. B. Rural Health Midwife Promotion Program. C. Rural Health Medicine Procurement Program. D. Rural Health Midwife Placement Program. The correct answer is D. RHMPP stands for Rural Health Midwife Placement Program. The Department of Health created the Rural Health Midwife Placement Program, or RHMPP, to address the inequitable distribution of midwives, and equip them for facility-based basic emergency obstetric and newborn care practice. Question number 6. If a midwife intends to assess the health problems in a community, which of the following should be done? A. Conduct a community assembly. B. Conduct a house-to-house campaign. C. Conduct a community health survey. D. None of these. The correct answer is C. Conduct a community health survey. Conducting a community health survey is the appropriate and most effective way to assess the health problems in a community. Community assembly and house-to-house campaigns are neither appropriate nor effective for the stated objective. Question number 7. Birth certificate should be accomplished immediately after delivery. It should be filed at the registrar's office within A. 15 days after delivery. B. 30 days after delivery. C. 45 days after delivery. D. 72 hours after delivery. The correct answer is B. Within 30 days after delivery. According to the civil registration procedure issued by the Philippine Statistics Authority, the birth of a child shall be registered within 30 days from the time of birth, at the local civil registry office of the city or municipality where the birth occurred. Question number 8. Which of the following is not a good characteristic of a questionnaire to be used in the community? A. It must be sufficiently interesting and have enough appeal so that the respondent will respond to it and complete it. B. Short enough so as not to take too much time. C. Questions must be asked such that the responses will not be embarrassing to the respondent. D. It mechanically forces responses from the respondent to be able to have a complete database. The correct answer is D. Mechanically forcing responses from the respondents just to be able to have a complete database is not a good characteristic of a questionnaire to be used in the community. Instead, a good questionnaire should be sufficiently interesting and have enough appeal so that the respondent will respond to it and complete it. It should also be short enough so as not to take too much time. And most importantly, the questions must be asked in such a way that the responses will not be embarrassing to the respondent. Question number 9. What does BMONC stand for? A. Barangay Emergency Obstetric and Newborn Center. B. Basic Emergency Obstetric and Newborn Center. C. Basic Emergency Obstetric and Newborn Care. D. Barrio Emergency Obstetric and Newborn Center. The correct answer is C. BMONC stands for Basic Emergency Obstetric and Newborn Care. BMONC is a primary health care level initiative promoted in low and middle income countries to reduce maternal and newborn mortality. In the Philippines, a basic emergency obstetrics and newborn care provider is a capable private health facility, or an appropriately upgraded public health facility, that is either a rural health unit, and/or its satellite barangay health station or hospital, capable of performing emergency obstetric functions. Question number 10. Which of the following is caused by a virus and is transmitted by a mosquito vector? A. Chicken pox. B. Malaria. C. Dengue hemorrhagic fever. D. Both B and C. The correct answer is D. Both malaria and dengue hemorrhagic fever are transmitted by mosquitoes. Usually, people get malaria by being bitten by an infective female Anopheles mosquito or tsetse fly. Only Anopheles mosquitoes can transmit malaria, and they must have been infected through a previous blood meal taken from an infected person. On the other hand, dengue viruses are spread to people through the bites of infected Aedes species mosquitoes. These are the same types of mosquitoes that spread Zika and chikungunya viruses. Meanwhile, chickenpox can be spread from person to person by direct contact, inhalation of aerosols from vesicular fluid of skin lesions of acute varicella or zoster, and possibly through infected respiratory secretions that also may be aerosolized. You have just completed Midwifery Reviewer number 4, which featured questions on primary health care. If you wish to watch more Midwifery Reviewers on primary health care, check out our Midwifery Primary Health Care Reviewers playlist. Check out also our other Midwifery Reviewers playlists for other reviewer topics. If you haven't done so yet, please don't forget to subscribe to Review Central, and click or press the bell button to make sure you get notified whenever we post a new reviewer or other review materials on this channel. Please like if you find this video useful, and feel free to share to anyone who may also benefit from it. We wish you all the best on your forthcoming midwifery licensure exam.